Dr. Eric, thank you so much for taking this time to speak to us today. Won't you please tell us a little bit about yourself?
Thank you very much, Bushi, and it's a pleasure. I am a practicing general practitioner with a special interest in infectious diseases. I started on the mines many years ago when HIV started off first and we had TB. I did my rounds through hospital management and pharmaceuticals, and then started working on HIV disease management, focusing on that. And then that led to diabetes oncology and medical advisor, to schemes on as far as that goes. And then when COVID started, it was a natural progression that the infectious diseases doctors would be expected because it's a virus. And so I've been working on that then since last year, January, when I went to Hong Kong with the intention of visiting Beijing. And unfortunately, somebody closed down Wuhan and I had to return because COVID was on us. And that's how the story started.
Yeah, all of us can remember that. Tell us, have you been vaccinated yet for COVID-19?
Yes, I got my J&J vaccination in March. And that's when all the healthcare workers could access their vaccinations, because I believe it as a frontline healthcare worker. We take reasonable precautions, but vaccination against the infection does not only protect you from getting the infection, most importantly, it protects you from getting the severe complications of an infection. And I've lost many colleagues over the last 18 months. So that's why, yes, there's compelling evidence to get the vaccination, irrespective of the amount of preventative measures you take.
Okay. Now, there are many people who are raising concerns about the fast development of the COVID-19 vaccine. Should people be concerned? And if we think about other vaccines that we've, been exposed to in the past, can you make a comparison between them?
Yes, it took 50 years to develop the polio vaccine. It took 5 years to develop the hepatitis B vaccine. But what we're seeing now is not new technology. These are the trials and the technologies that is dusted off and brought into the workshop very quickly. They originate from the HIV vaccines. So we've had 270 different vaccine trials in HIV. And all that we did now is we went and changed the packaging, or the package that the virus and the different technology delivers to the person. And so it's not that it's that fast. It is faster than the usual, but it is using technology that we've developed over the last 15 years already. And it has revitalized the HIV trial initiatives as well. So it is not that it was suddenly developed for COVID. It was, we took the existing technology, adapted it, and there's 13 more coming.
Okay, so you can safely say the scientists are not using us as guinea pigs.
All the vaccines have to first go through registration trials. But we have, after registration trials, you then have the registration, but you still have to monitor for potential side effects. So it's a post-launch monitoring, and all caregivers are supposed to report adverse reactions, document that, because you go from a few hundred people to a few thousand and now billions of people. So you could not have anticipated every possible side effect when you were still at the few hundred and a few thousand phase. So we must remain vigilant. we do react. There was a period of time where the Johnson & Johnson vaccine was temporarily suspended until clarity could be sought as to whether it does cause a drop in platelets and clotting issues. And then it was found to not be as significant. So it is constantly being monitored, and there's high level of vigilance. And it is the duty of all healthcare providers to monitor and report so that we can improve or pick up early if there is a danger sign.
Okay. You've touched a little bit on some of the side effects. So we've heard a lot of information about some side effects being, reported after having the COVID-19 vaccine. Are there specific side effects that we should look out for, and what are the risks of having severe side effects?
At the time of administration, the person has to be monitored for 15 minutes in case they develop an anaphylaxis. So you might remember years gone by, we said, are you allergic to eggs? And then we couldn't give you the flu vaccine because we then were culturing the flu in chicken eggs. And so that protein would be introduced into your body and you could then have an anaphylactic reaction. So that's why we don't use that technology anymore. But the same happens now, that you have to be monitored for the worst possible reaction, which is an anaphylaxis. So you have to stay in the vaccination center for 15 minutes and be monitored. You then get given a number to report anything that you might experience, and that happens later. But if you get through the first 15 minutes, and we haven't seen people really having that, but that is just one of the precautions taken. As with any vaccine, there must be some side effects. Otherwise, you just had a shot of saline. Its duty is to activate your immune system. So you're going to have a bit of tenderness there. There's been a needle that has gone into the muscle and it has deposited 1 or 2 milliliter of fluid there. But that fluid is specifically designed to elicit a response, not to hide from the immune system. So your immune system identifies it and then mobilizes into that area. And it then brings in white cells, they release histamine. That's where you get a bit of swelling and redness, and it can be a bit uncomfortable. But that's with any vaccine. We have that risk. So it is, that's the local reaction. Then you've got what your body then does in first now being alerted to this, and that can vary quite considerably. Children get their vaccines and they have and it's usually very low doses of antigen that is used. And they get so many vaccines because their body is constantly learning. Now, as we get older, we need to use higher doses of antigen to elicit the same response. And somebody might have been vaccinated or exposed to we have other coronaviruses. So you could have been exposed and already have a defense against something looking like COVID. So your response could be a bit more aggressive. Most severe is that people feel very fluish and tired, lethargic, and they just need to rest. And that is your body saying, look, I'm busy with this infection. Please just calm down. Let me get to my work and stop running around so that I can do what I should be doing.
That's a nice way of putting it. I feel a lot more relaxed about it. And tell me, would you recommend that your chronic patients, those who have HIV or diabetes or hypertension, to take the COVID-19 vaccine?
At the start of the pandemic, those were the patients that we were most concerned about. It was the elderly because they had comorbidities. Now, the comorbidities is diabetes, hypertension, asthma, and that is more associated. So it is not a 1 plus 1 effect. It's a 1 plus 1 equals 5. And so that is why we were so concerned about that. And we still want a diabetic person, somebody that's overweight or have previous respiratory problems. Those are patients at high risk. And that's why we also target them for example, for vaccination with the pneumococcal vaccines. Patients with HIV are equal, and that if they on treatment and their viral load is suppressed, they must be vaccinated as well, because it will provide them the same benefit that it will provide anybody else. It does not interfere with the HIV medication and vice versa. So because we have 7 million people in South Africa that that have HIV, and we have got 8 million diabetics. So if those are the people that might actually need it more, and that's why we're so grateful that we can now actually expand the vaccination to all age groups, because our biggest growth in HIV-infected population is our youth, is our young women between the ages of 15 and 24, unfortunately. So we need to get to everybody to vaccinate and protect them, to support their immune system.
Fantastic. So you are at the forefront of the support that we provide to members of schemes who contract COVID-19. Can you share with us one or two moments or experiences that have had an impact on you in the last year?
It has taught me that every case is different. Some patients deteriorate quite rapidly. It's within hours, and they are short of breath, and they are in dire need of hospitalization. Other patients don't even have symptoms. So in one family, which is genetically a very small group, one person unfortunately passes away, one ends up in ICU, two feel mildly in, and the fifth member of the family has no symptoms at all. So it has just taught me the humility and respect for the virus, but also the completely different ways that everybody reacts to exposure. And so that's why we need to individualize, and that's why our backbone of our treatment is symptomatic relief. They will eventually overcome the infection. They will eventually clear it, but we need to help them through that period of time and act quickly if life-threatening conditions occur.
Okay. And what do you wish you or the society could have done differently now looking back at the 18 months or so of COVID-19?
We were working so hard on just trying to, we were overwhelmed as on healthcare workers. And I think we lost the opportunity to educate our population and our societies more. That it actually, the responsibility is in their hands, and they are actually in control. They must understand a super spreading event. They must understand the risks that they're daily exposed to. They must change the way that they wash hands and what they touch and who they share spaces with. That by the time a patient enters or becomes ill and engages with us, actually, we have failed in our first responsibility, and that was to educate and prevent. And now with the vaccines, we can start doing that. But the communication also changed so rapidly. We learned per week from COVID what we learned per year in HIV. That's how quickly things changed. What we thought was working, then 6 months later, we realized it's not going to work. So we did not have the luxury that we had with HIV to have extended trials happening all over the world, because everybody was hit at the same time and everybody was all hands on deck. So we were literally just retasking everybody to care, and not enough people maybe sitting back and looking at the bigger picture.
Wow, thank you for shedding the light on that, because obviously, as regular people, we have no idea what's happening behind the scenes. But talking to you is just giving me a lot more appreciation for your profession. And especially me myself, I have also been infected by COVID. So having somebody like you on the line definitely makes all the difference. So, Dr. Eric, thank you so much for taking the time to talk to us. And I'm very sure our members will find this very beneficial.
I hope so. Thank you very much for your time, Lucy. Have a nice day.
Thanks, Dr. Eric.
Thanks.